This conference will now be recorded.
Great. Hello, everyone. This is Sarah Brinkman with the National Rural Health Resource Center. I'd like to welcome you all to the second webinar of the SHIP Lean Training and Mini Project for 2015. I'd like to introduce our instructor for the course and this webinar, John Roberts. John is the CEO and President of Midwest Health Consultants. He has a Lean Healthcare Black Belt and an extensive background in successful Lean implementation with over 35 years of professional healthcare experience. All right, John, with that, you can take it away.
Thank you, Sarah, and welcome back to everybody to the second webinar of our series in looking at Lean and becoming more familiar with the concepts and methodologies of Lean. Before I get started today, I'd just like to encourage everybody who hasn't finished their waste walks to go ahead and finish those here in the next couple of weeks. I think Sarah posted that the hard deadline to finish those is the end of the month. Hopefully I've responded to many of the questions that you've submitted to me regarding the waste walks. For those of you who haven't started those yet, there is no right or wrong way to do the waste walk or to report the results of that waste walk. What we want to do is to get you involved and get you to look throughout your facility and to begin to identify the 8 areas of waste. And like any skill, when you do that more, you'll get better at it. And so our main focus is for you to get to look at and see with new eyes those different kinds of waste and to be able to identify those within your facility. So let's get started with today's presentation. I'm really excited about today's presentation because we actually get into many of the tools, the actual Lean tools that we'll be working with. And there's 4 main tools that we're really going to talk about today. Value stream mapping, 5S, which is a worksite organization tool, A3 problem solving, and then finally standard work. We could take up to 2 or 3 hours in each one of these areas, but we want to give you an opportunity just to get familiar with what each one of these tools are and what they do and how they can help you in becoming more efficient, providing more value to your patients and customers, and obviously reducing waste. The work we've done with the many clients that we work with in using the variety of different Lean tools, these 4 tools that we're going to talk about today really can solve a majority of your issues that you're dealing with in your facility. So value stream mapping, 5S, A3 problem solving, and standard work are the building blocks really to being able to solve and deal with a majority of the issues that you're going to be working with when you're working with Lean methodologies and Lean tools. Even though these 4 areas are the kind of the building blocks or the foundational tools, many of the other tools that you see are in Lean, such as visual controls or error proofing or other types of Lean tools, can be pulled into these 4 different tools, and we can use them in combination to really begin to deal with the issues we're trying to look at. The first one we're going to look at today is value stream mapping. Value stream mapping is, I think, one of the best tools in the Lean toolkit, although it does take a considerable amount of time and, in many cases, effort. It is a spectacular tool to really identify issues in a process where there's waste, and to be able to do that, and to be able to streamline that that particular process. As we talked about in the initial introduction last time in the last first webinar, wherever there's a product, or in this case a service provided by a hospital, there's a value stream that's attached to that particular process. And as we saw in identifying waste, our challenge really becomes in how do we see that process, and how do we see it for what it really is, and what's actually occurring in our facility. Value stream mapping is basically seeing the flow throughout the organization, regardless if it's a segment maybe of a process, or if it's something that we're looking at from when a patient gets admitted to the hospital all the way through to when they're discharged, and looking at that complete value stream or process throughout the process. Sarah, it looks like I've lost the rights to the presenter.
Yeah, you fell off there for a minute. I just gave them back to you. Oh, you fell off again. It looks like maybe your internet connection is having some issues. Are you still there, John?
Yeah, still here.
Okay.
Internet's fine here on this end.
Your name is disappearing from my list, so I'll go ahead and move things forward for right now, and you can figure that out. Let me know which side you'd like to be on.
So one of the basic values, I think what makes value stream mapping so good is that it gives us a graphical representation of how a patient flows through a particular process, what kinds of materials and information that need to go along with that patient at any particular step or task in the flow of the process. When we look at the definition of a process, it's really a set of steps or tasks that we use to input into the process, which helps to produce an output for our customers or our patients. And again, I love this quote by Edward Deming, is if you can't describe what you're doing as a process, then you really don't understand what you're doing. And I think that's really true in many of the things that we're doing. What appears in some of our standard operating procedures, our process, or standards policy manual is not what's actually happening out as things are done in the workplace. So what is the value stream? First, if you remember back to the principles in lean and lean thinking, we want to define value from the customer's perspective. So again, we're looking at the steps in the process and whether or not they are adding value, they're non-value added, or if they're required by some kind of survey or licensing agency. When we go through the value stream mapping process, it helps us to identify those value-added steps, those non-value-added steps, and again, gives us a sequence of what's actually happening. Value stream mapping can be used, again, to reach a large process, or it can be used in a single stage of a process or task. It can be used either way, and it's very versatile in the way that it can be used. One of the main things that we get out of value stream mapping and analysis is really a common understanding of what the current process is. Too many times we view the process from our particular department or area. We don't understand what we call upstream and downstream, and how what we do in any particular department can affect people upstream and downstream. So this really gives us a visual cue, a true picture of what the process is. It also gives us a baseline of measurements when we look at and document time, the time element, other things in the value stream mapping process, how information flows through that process. It really does give us a bench line for those to look at how we can improve that as we go further. It gives us a vision of what the future process might look like. It'll definitely give us opportunities for improvement and a way of kind of setting up an implementation plan to be able to improve that. When we look at value stream mapping, in particular for healthcare, again, we're looking at everything from the patient's point of view. And again, we're looking at how we can improve that value and eliminate waste as we go through and look at how that process is actually working. Again, why is value stream mapping helpful? It gives us a visual of that process instead of looking at it from strictly words in a procedure manual. It helps us to identify and eliminate waste. It also helps us to identify bottlenecks, or if there's a resource, lack of resources in a certain point of a process. For instance, there may be in the medical records area, they're backlogged in getting things coded and getting things put together so that they can be billed. And again, the value stream mapping will help us understand that there's a bottleneck at that particular point and that we may need to apply or provide more resources in that area to be able to eliminate that bottleneck. And again, it helps the employees and the staff who are working on this particular lean tool understand not just a single function of that particular process or their specific department, but to understand and get a systems perspective on what the process looks like. So what we want to do is the first step in value stream mapping is to map out the current state and really look at it the way it is and the way we're doing it today. And this doesn't have to be a high-tech procedure. Many of the clients I work with will use sticky notes, as you see in the pictures here, to really define what the major steps in the process are, how information and patients are flowing, what kind of materials or inventory need to be brought into the process at that particular step in the process. We usually use a value stream mapping team, which is comprised of anywhere from 3 to 8 participants. And we usually have somebody who's the leader in that particular value stream mapping process so that they can apply the tools of the value stream mapping system. Some tips for creating a value stream map is to get everyone who's involved with that particular process involved in the value stream mapping team. So you may want one person from several different departments who are involved from start to beginning to be involved. That's very important because we want people to see, look at this from a systems perspective, a systems analysis. And when we don't have people in the team that have control over that part of the process, we're missing out on a big part of what we can do to resolve that issue and streamline that process. The second thing I think is that we want to actually go out and walk the process, similar to what you're doing with the waste walk now. We want to actually maybe follow or shadow a patient through the process and really look at what's actually happening in the front line. The reason we want to do that is that even the best facility, when they're looking at a standard operating procedure, when 3 or 4 people look at that procedure, they can interpret that different ways. And so we know that the work we've done is that it can vary, a process can vary by day or night shift, by week or weekend shift, or just by different people within the process. So going out and actually walking the process is an important part of that, getting to know where you are with the current state map. What we want to try to accomplish with the current state map is to define the boundaries of what we're going to be looking at in our value stream. Very important because, again, we want to make sure we're looking at specific portions of a process and establishing boundaries around that. Again, as I mentioned before, we want to define the value. We want to identify the specific tasks in each process and identify the resources that it takes to implement that specific task. The current state map really sets us up for the next part, which we'll talk about, and that's creating the future state map. And again, the difference between where we're at currently and where we want to be with the ideal state really helps us develop an action plan to be able to get there. Here's a sample of a current state map. This one happens to be for a patient office visit. And you can see the major steps in that particular process, from admissions or receptions to the nurse, what the nurse is going to do when the physician does his treatment, to the nurse following up with whatever the discharge are, and then the checkout of the patient. So basically, value stream maps work from left to right. At the bottom usually is the time element. So we would see in this particular example, it takes 2 minutes to check them in. They wait for 25 minutes before the nurse takes them back. She does her vitals and takes the chief complaint, which takes about 5 minutes. There's 15 minutes of wait time before the physician gets in, and so on and so forth. So again, we're mapping out the flow of this particular patient through this process. So again, we can see at the very top, you see what we call Kaizen bursts. And those are things that we can see right away that there seems to be a particular issue with. For instance, we want to ask, why is the patient waiting 25 minutes? Why are they waiting so long? Next one is, are the nurse and physician communicating effectively? And so those are areas that we'd want to, that obviously are popping up right away that we can take a look at and see if we can get resolved. But this is a great example of a strategy value map. The next step is the future state map. So if we know where we are, we've documented what the current process and procedure is, if we could redesign that process and make it flow better for our patients, what would that look like? And that's really the future state map. So we use the current state map to identify those areas where we think we can get improvement. And again, we put these together in what we call Kaizen bursts. These are short, intensive opportunities to take care of those specific issues, which basically are no-brainers in the process. We want to, in our future state map, we want to, again, decrease the non-value added steps. We want to increase the value added steps. We want to reduce any long or waiting times. We want to look and reduce where there's priorities that don't match between departments, long processing times. Again, this is where we identify or begin to identify what we can eliminate in this particular process to streamline the process and move the patient through the process with greater ease and flow. Once we begin to have that future state map and we compare it to the current state map, we begin to prioritize what needs to happen to be able to get us to that future state map. And that's really what we do in creating a detailed implementation plan. Again, some of these process steps may take a considerable amount of time to change. And so we want to take that into account as we develop our implementation plan. We always want to take the things that we know that we can change quickly and gain efficiencies and reduce waste and take care of those first, and then look at the other issues that particularly are probably more complicated, may take additional work and consultation with different parties to be able to change. The keys to success in a value stream mapping process are having the right people in the room, making sure that everyone who's involved with that process, every department is at least represented, and making sure that we have frontline people in the room, because they're the ones that can give us the best insight as to what's working, what's not working, where there are bottlenecks in the process. We need to make sure we empower this team, again, to make immediate changes where they see breakdowns in the process that can be easily changed and eliminated. We have to have full participation from all the team members. And again, probably one of the keys to value stream mapping process and lean methodologies in general is that we attack issues in the process, not the people that are doing the process. We find in all the research in lean is that the major breakdowns in a process in any organization are caused by the process themselves, usually not the people unless they're just being negligent. So I think that's really important when you're doing value stream mapping, is we're making changes to the process to improve the process for the patient. Make sure you agree on the measures, the baseline measures, and the final measures that we'll look at on how we're gauging whether or not the changes we're making are actually improving the flow through the value stream. And then really setting up a process so that we're frequently looking at whether or not the changes we're making are actually working. And too many times I've worked with clients who develop and make changes in the value stream, and then they're off to the next thing, not looking to whether or not to see if that's created problems or if it's actually working as they intended. So that's value stream mapping. Again, value stream mapping is a great tool to use to identify and look at value versus non-value added value in a particular process in your facility. So let's move to 5S, which is another great tool that's used in lean methodologies, and quite frankly, probably the one you're going to use in your projects as we move forward here in the next few months. 5S is a great place to get started in lean because it really deals with worksite organization, and it allows people to be able to really see some of the lean concepts in action when looking at workplace organization. And so I always counsel a lot of the hospitals that I work with is to probably the best place to start is with some type of 5S worksite organization project. So 5S stands for sort, set in order, shine, standardize, and sustain. And really the basic concept of 5S is developing a visual workplace and creating a workplace that really makes sense from an operational standpoint, that makes sense efficiently in your use of motion, in the use of inventory, and some of the other ways that we've talked about. Just to give you a brief overview of which of those 5 S's, what they are specifically, is first of all is sort. It's really taking the things that we don't use or don't need and separating and getting them removed from the area. I always find with working with clients is that they have this just-in-case mentality of keeping things around even though they may not have used them for but the last 10 years. Again, they just want them there in case they would ever need it. So we want to get rid of those things that aren't used in our area. Set in order is making a place for everything and everything in its place. Having some rationale to where we put things, where we place things for our work site and the tools, the equipment, the supplies, all those types of things. Having a realistic and logical sequence to where we put those things. Shine is making sure that our work site is cleaned, that it's not cluttered, so that we can find things when we really need them and at the point that we need them. Standardize is making sure that we're putting methods in place that make sure that what we've set in order, the way we've logically set up our workspace, it sustains that, makes sure that things get put back and into place, and that we don't lose the gains that we've made through the reorganization of our worksite. And sustain is, in this case, another word for standard works, which we'll talk about here in just a little bit. But it's creating a habit for continually improving our worksite or workspace to make sure that, again, we're improving, that we're cutting down motion and workflow in other ways. Sometimes you'll see in healthcare 6S, and that's for safety. We always want to make sure that whatever our worksite or organization is that we're taking into account the safety of not only our patients but our employees. Worksite organization and waste in that area really becomes clear when we see that when we get new products or supplies or we get a new piece of equipment, where do we usually put those things? Well, we usually put those things in areas where we have an opening or create a new space. And again, when we don't think about those things over time and how we're going to use those specific inventory or a piece of equipment or information, we create waste in that process. And that's what we're trying to eliminate in the 5S process. One of the greatest things that you'll see when you go through a 5S process is that we can minimize and really reduce the waste of motion through this process, and our ability to, again, identify and get our equipment and supplies when we need them, at the point we need them, in the right amount that we need them, are really what the benefits of 5S are. We always want to start out by, and I encourage the people that I work with and the clients, is to photograph their current conditions so they can see what it really looks like now. And again, what we'll generally see when we go into a specific work site area is unorganized workspaces. We see people hunting for things that they may not have right at their hand. A flow of work is not really evident. We see many times when people don't have what they need, they hoard supplies. And again, so you'll see all these things when we do the Gemba walks, when we walk through and look at the current situation in our workspace. When we use the 5S methodology, almost always we will decrease the number, the wasted space that we need. We will decrease the waste of people resources. We will improve safety, and we'll decrease staff motion. I've never really worked in a 5S process project yet that we haven't been able to significantly impact those different areas. So let's go through and give you some visuals of what we're talking about in each step. First step is the sort. Again, we want to separate the needed from the not needed. And there's specific tools that we can use to be able to do that, what we call sometimes red tagging. We have people go through and go through this process as a team and really identify those things that we don't use anymore and that can be removed from our workspace area. So as you can see in the before and after pictures of really getting rid of those things that were in the workspace area that really weren't used anymore. The second step is to set in order. Again, we want a place for everything and everything in its place. We want the things that we use the most to be most logically, centrally located. For instance, in the ER room, the things that we might use for the top 10 procedures that we do in the ER room, we would want those things located probably at eye level. We would want those things that are used most frequently at that level, and then we would work out from there. We'd put things that we don't use as frequently, maybe higher or lower. But again, we're looking for a logical sequence of what we use and how we best can get to those particular areas. One of the things we do in the set and order process is we begin to tape off and mark where things are located and where they need to be. And so that gives us an indication of when something's missing, we know that we need to restock that or we need to replenish that supply. Again, we need to build in step 3 in this process is what we call the scrub, to make sure that we're continuously looking at making sure our work area is clean and that it's working correctly, and that we don't have excess clutter, and that takes adding some type of inspection to that work routine on a daily basis. For instance, ER, the ER nurse that's coming on that shift may be built into her routine before she starts her shift to look through and make sure that they're not missing anything that they might need for taking care of a patient that day. Standardization comes in, again, making sure that when we put everything in its place and everything has a place, that we're making sure that we have operating procedures that when people take a piece of equipment out of the central storage room, that piece of equipment is returned back to that specific spot. I can't tell you how many times I walked into a storage room where people use a piece of equipment and they just shove it back into the room, and then the next person that has to find a specific piece of equipment has to dig through and push other pieces of equipment away to be able to find what they want. So you can see in this particular picture of a project we did, as you see on the floor, it's taped off where each piece of equipment goes, and it's marked which piece of equipment goes there. And so when people get done with that particular piece of equipment, it's expected to go back into that spot. And again, that reduces a lot of wasted motion, wait time trying to find things that you can't find when you need them. And fifth, the fifth step in the 5S process is to sustain the gains over time. So we do that by making it more visual, so that somebody could come into the storage room, for example, who doesn't know anything about how it's organized, and intuitively they could probably find what they needed to find. They could go to what we call this marker board at the end of the row, which tells them exactly where different supplies are located, and to be able to find and get what they need, even though they may not work in that particular area. That's what we're looking at in being able to sustain or standardize the process. We want to assign responsibilities to people. We want them to incorporate those in their regular work duties. And again, we want to have some kind of check system so that we're maintaining the supplies and equipment and those things that we have in our workspace that we need on an ongoing basis. One of the key things that you're going to see in 5S is a great reduction in unnecessary motion in our staff. And when we begin to really think about how do we lay out our workspace that makes the most sense, making sure that, for instance, in laboratory, if we take the top 10 procedures that we do on a daily basis and make sure the equipment is organized in a workspace where we're not traveling back and forth across the room. Again, those are the key things that we're looking at when we're doing 5S. And I really want you to think about how many times that we do a particular procedure in a day, in a given day. And if we can do a 5S process, for instance, and reduce the time it takes to do a particular procedure, say in the lab, by maybe 2 minutes, just think about if that procedure is done 15 or 30 times a day on different shifts, and we save 2 minutes each time. Think how that compounds itself when you're looking at day after day after day being able to save at least 2 minutes. Say if we did save 2 minutes on a particular procedure, and we do that test 30 times a day, we've saved an hour per day. Take that times 365, and you've saved 365 hours over a year's period of time. And even if we used an average wage of $20 an hour, you're talking about a savings of almost $7,500 per year in just looking at that 2-minute time reduction and not wasting that time in motion. And again, you'll see in 5S projects that the savings can add up pretty substantially, pretty quickly. So 5S is a great way to organize and go through the worksite organization. The next topic we're going to talk about is the A3 problem-solving process. A3 is one of my favorite tools because we can use it to engage everyone throughout the organization in becoming problem solvers. And again, when we're looking at a problem, we're really just looking at the gap between where we are currently or the issues we have now and where we want to be. And how do we get from one side of the canyon to the other, per se. And so we want to use the A3 problem-solving process to be able to empower people to solve problems more quickly. And it's usually that it's not that people aren't smart enough to solve problems. It's that most people don't feel empowered to do it, or they don't know exactly what the best process is to be able to do that and solve that problem. And so what A3 does is give us a common structure throughout the organization on how we're approaching problem solving. And it allows us to, when we have the structure there on how to solve problems, it really releases us from worrying about what's the right steps to be able to solve this problem, to really concentrating on how we can solve the problem. Why is solving problems difficult in hospitals? These are some of the things that I've observed in working with different hospitals. One is that the departments see problems differently. Different departments see things from their particular focus or their particular point of view. Another one is that hospitals tend to leap to solutions rather than really identifying root causes of problems. A lot of times these solutions are implemented without fully considering it, the options for solving that particular problem. And we have this kind of firefighting mentality that we use a lot of times, and just we're so busy solving problems and taking care of problems, we really don't look upstream as to why all these problems are happening. And if we took the time to look upstream and solve some of those problems, we probably wouldn't have to do as much firefighting. And again, A3 helps us go through that particular process. When we have a structured way of problem solving, it creates better thinking, better understanding of the problem. We can communicate the problem to different staff people, and we get much better consensus on what we should do to solve that particular problem. The thing I like about A3 problem solving is that it gives us a way to team problem solve, that we can work together in a team to look at different issues and try to resolve those particular problems. We want to take advantage of this team-based problem solving because we know the people who are on the front line know their jobs best, and they know probably what to do to solve some of those issues. It gives us broader, more creative solutions. There's a greater chance of risk-taking. When you have one or two people trying to solve a problem, they're going to be very conservative in how they create solutions for that particular problem. Why? Because if it doesn't work, they think the blame will come back to them. And so when you have team problem solving, they're much more willing to take a risk and come up with creative problem solving. Probably one of the biggest advantages of team problem solving is that there's a lot of ownership once everybody's been involved in solving that problem and coming to a solution. There's nothing really stellar about what A3 is. Basically, it's 11 by 7 piece of paper. But again, the value and the strength of A3 problem solving is that it's on one piece of paper. It's in a visual format, and so we get to the root of the issue much more quickly, and we can visualize that particular problem, and again, have the structured way of looking at it. Those of you who are familiar with the Plan, Do, Check, Act process, this A3 is built on that methodology. And so you'll see on the left side of this particular A3 template is that we're doing the planning on the left side of the sheet, and we're doing the Do, Check, and Act on the right side of the sheet. So we follow that methodology in what we're doing in A3 problem solving. So on the left side, the plan side, we're looking at the background. We're clarifying the problem. We're looking at the current condition, making sure we understand exactly what's currently happening. Then we set our goals. If we resolve this issue, what does it look like? And then look at the problem analysis, again, the root cause of what's actually causing this particular problem. Then we go to the Do, Check, and Act side, which is what are the countermeasures? What are the specific actions that we're going to take to solve this problem? And then we look at the effect confirmation. We look at the measurements and look at and see, are the things that we're doing are changing to solve this problem actually working? And then we have the follow-up section, which makes sure that we sustain these changes over time, and that we're looking at them and making sure that we've solved the problem and that we're not sliding back into the previous area. Here's an example of an A3 report that's filled out. As you can see, we want to make it very visual. We want to use short bullet points to point out what the problem is. In the second section there, you can see we use kind of a process flow chart to identify the different tasks in each area. And I'm just going to go through the pretty quickly, just introducing each area, and so you can see it a little more specifically. This particular example has a staff person who's become more tardy in his work, and so we're going to look at how we resolve that particular issue. So we see as tardiness is going on, so we want to ask what's going on, what's happening. We want to lay out the facts. We want to be detectives and laying out exactly what's happening in our current condition. We want to establish our goals. We want to reduce his tardiness back to where it used to be. His old rate was 1 tardiness. It's gone to 12. We want to reduce it back to 12. So we set specific targets for what we're trying to accomplish. Again, we're trying to find the root cause of what's happened in the staff members becoming more tardy on a more consistent basis. And again, we want to put in our countermeasures of what we're going to do to work with this particular employee to resolve this particular issue of being tardy. Then again, we want to look and see if it's working. In this particular case, we can look over the following 3 months that his tardiness started to become down and back into the area where we wanted it to be. And again, we want to follow up actions to make sure if other improvements are needed or things working the way we anticipated doing. So the A3 thinking, the report itself is not sophisticated, but it's really built on a sophisticated system-wide thinking of, again, looking at team and looking at teamwork and the way that we solve our problem. And again, when we get people in the organization to feel empowered to solve problems and not wait for somebody to tell them to solve the problem, that's when we get breakout performance in our organizations. So let's talk about the final tool, standard work. Standard work is probably one of the most effective lean tools, but one of the least used tools in the lean toolkit. The basic definition of standard work is using the best combination of activities that minimize non-value added activity while providing the highest value